Colorado is going to vote on a single-payer healthcare system. Proponents of a single-payer state system have gathered enough signatures to put what is being called Colorado Care on the ballot. The Secretary of State's office has announced the proposal would make Colorado the first state to provide health care at in this way as a single-payer system. It's called Initiative 20, and it will be on the 2016 ballot. The way it would work is that residents would be able to choose their own health care providers, but Colorado Care would pay for the bills. So what is being said about the possible cost of this? Well, the backers of Colorado Care estimate that they would be able to raise $25 billion a year for healthcare costs by adding a 10% payroll tax. The critics say this is a huge expansion of government. This is going to double the size of the state budget. This is going to penalize people with even more taxes. What does Ivan Miller, the executive director of Colorado Care Yes and the head of the Colorado Foundation for Universal Healthcare say? He says, hold on a second. If this passes, residents will gain premium healthcare coverage for $5 billion less than they pay now. It would slash administrative costs in terms of private insurance. The state would be able to negotiate bulk rates for pharmaceuticals. The coverage would extend to anybody who earns income and lives in Colorado. The counter to this is people are saying, well, if the state is going to pay private insurers, then insurers will just jack up the costs. And that makes absolutely no sense. There are already rules with regard to the setting of prices, price gouging, etc. Those rules wouldn't disappear if Colorado Care was passed. So I think that that is a bogus red herring. It's a straw man argument. And the other consideration that we need to have is that Colorado already has a pretty nice profit from recreational marijuana. And currently they have these rules where if they take in more than a certain amount in taxes from recreational marijuana, they have to return a portion of the excess taxes to single payer. They have to return a portion of those excess taxes to the residents. Maybe the residents would be up for that money going towards the single payer healthcare plan in order to offset some of those payroll taxes. Remember that if you don't have to pay for your health insurance, you're going to get more of your paycheck back as it is because of the reduction in that deduction that exists to pay for your health insurance. So maybe you would say, hey, you know what? I don't need that excess money back from the healthcare, from the marijuana tax. Let's put that towards the state single payer program. So this is huge. Unfortunately, the attempt in Vermont kind of failed. It stalled. And here is another attempt that we are looking at, and hopefully we will have good news.